Hello everybody, today I'll continue my last lecture about CT basic physics, okay? Today we will talk about the aim of CT scan or the patient dose. How can I calculate the patient dose? Okay, you have to put in your mind that the aim of CT scan to scan patient with less dose, okay? To get less patient dose and to get optimum diagnostic image. This is the main target of as an operator or for scanning any patient, okay? So adjustment of any protocols for CT scan depends on this concept to make sure that your protocol will get optimum diagnostic image and less patient dose, okay? What's the meaning of patient dose? The patient dose, because the patient is absorbing radiation, so we have a term of absorbed dose, okay? Let us talk a little bit about the radiation. Here you will find that this is our patient and this is X-ray tube, and this is the patient, okay, and this is detectors, okay. Radiation coming out from the X-ray tube. Some of X-ray photons incident on the patients are absorbed by patients, okay. The amount of photons which are absorbed by patients, okay, per unit of mass of patient, the amount of these photons have energy, okay. The amount of energy of photons per unit of mass of patient, so the mass is weight of patient of mass or mass of patient. This is absorbed dose, okay. So the absorbed dose is a total amount of energy of photons absorbed by patients, okay, per unit of mass, okay. The unit of this absorbed dose is joule per kg, okay, or in another term is called Gray. This is absorbed dose. We have three terms, okay, three definitions: absorbed dose, equivalent dose, and effective dose. Absorbed dose, equivalent dose, and effective dose, okay. So now we have, if we talk about the dose, we have absorbed dose, and equivalent dose, and effective dose. For absorbed dose, which is the first term, the amount of energy absorbed per unit of mass, okay. This energy coming from photons or coming from any other types of radiation. Maybe this energy coming from electrons or alpha particles or X-ray or beta particles and so on. So there are different types of energies, okay. So whatever the source of energy, okay, this is called the absorbed dose. The total amount of energy absorbed per unit of mass. But if we want to classify the dose absorbed by patient, okay, according to the type of energy source, maybe electrons, maybe X-ray, maybe gamma ray, or beta particles, and so on. So we have to move to another term, which is equivalent dose. Equivalent dose is equal to the absorbed dose. This is equivalent dose, which is be the absorbed dose times quality factor. What's the meaning of quality factor? Quality factor is a factor related to the type of energy source, gamma ray or X-ray or electrons or beta particles and so on. Because there are different types of radiation, as we know. We know well that we have alpha particles or beta particles or X-ray. So the energy absorbed per unit of mass for alpha particle, not like beta particle, not like gamma ray, not like electrons. So there are different types of source, so different energies absorbed, different depositions of energy of this source of these types of energies. Okay, so that means quality factor. Quality factor, you will find that quality factor for X-ray and gamma ray is 1. So we substitute here. If we want to calculate the equivalent dose, we will find the absorbed dose times 1. So the equivalent dose for effective for X-ray or gamma ray is equal to the absorbed dose, okay? Because the quality factor is 1. But for alpha particle is heavy atoms, deposit a lot of energy, okay? Deposit around 20 degrees greater than X-ray or gamma ray. Okay, so the quality factor here for alpha particles will be 20. So if you want to calculate the equivalent dose for due to alpha particle or because of alpha particle, you have to multiply absorbed dose times 20. That's for alpha particles. So the another term is, the third term is the equivalent dose. Equivalent dose here represent the type of tissue where the energy of radiation is absorbed. Maybe the energy of radiation is absorbed in stomach or liver or thyroid. There are different types of organs inside our bodies, and each organ has a specific sensitivity to radiation. Okay, the organs which divide by time, reproduction ability or has a greater reproducibility, highly sensitive to radiation. Like bone marrow is highly sensitive to radiation. Thyroid, highly sensitive to radiation. So, according to the tissue sensitivity, we will get another term, or the third term, which is effective dose. So the effective dose will be the equivalent dose times what? Times tissue weighting factor, WT, tissue weighting factor, which is related to different types of organs inside our bodies. Okay, so the effective dose is the third term. As you are a worker, you are working here in a radiation field. Your dose, which coming from Neset or coming from Australia, okay, is effective dose, not absorbed dose, not equivalent dose, is effective dose. So the most important term is effective dose. How can I calculate the effective dose for patient in CT scan? Really, till now, no accurate estimation for the effective dose. No accurate estimation for the effective dose for patient in CT scan. But what's happening now, and how can I get information from my CT machines to give me indication about the CT dose or the CT patient dose? Okay, that's what we will be what will be known now. Okay. So now I have a patient. This patient is exposed to X-ray tube, exposed to X-ray, so I'll get detected by detectors. Okay. Okay, this is X-ray photons absorbed by patients. Okay. When I scan patient different slices. When I get the dose per slice, okay? This is the X-ray tube, and this is the patient, and this is the detector, okay? Slice width is important. Slice width. If you scan patient to scan one slice, this slice is 5 millimeters. So you expose the patient only the thickness of patient which is exposed to radiation is 5 millimeters. But if we increase the slice thickness of patient or the scan slice thickness of patient, so the slice width increase to be 10 millimeters. So you scan great area, you scan 10 millimeter of patients, okay? So the exposed area in patient will be higher. So the slice thickness is very important to calculate the dose of patient. Now, if I want to calculate the dose here, okay, in this width of patient, I'll get profile like this. This is dose, and this is a curve which is representing the dose, and this is distance. The distance through the patient, distance of slice. We are moving now from the first of slice to the end of start. This is our starting point, and this is end point. In the center of our slice, you will find the highest dose. This is center, and this is peripheral region. This is peripheral, and this one, and this region is the center of the slice, center of our slice, okay? So now, this is the slice profile which is representing the dose of one slice, So now, I want to calculate this dose. Summation, if I calculate the area under curve, how can I do this? It's easy. Using phantom. Like the phantom we are using, CT dosimetry phantom. Here. We will calculate the dose for one slice using this phantom. This is acrylic phantom, okay, which is composed of as you see here, holes. This hole, center hole, and 4 peripheral holes, okay? This hole, okay, is suitable to both ionization chamber. This ionization chamber is used to calculate the dose at this region. So if I want to calculate the dose, CT dose integrated, which is representing the dose per one slice, CTDI, is the average of the dose through the phantom. Third CTDI and 2/3 CTDI periphery. So the dose in the center, okay, and so the average, we get the average of those here. We will get the dose here and center region and the peripheral region, okay. So you will get the average value of these doses, okay. You will get CTDI weighted. This is the phantom used, and this is the ionization chamber used to calculate the dose of this phantom, okay. And this is the monitor which gives you the reading of the dose, okay. And you will get CTDI weighted. CTDI weighted, which is representing the dose per one slice. But when you scan patient to get one slice, okay, the table movement is important, which is represented by pitch factor. If you scan patient very fast and table movement is very fast, okay, so the dose absorbed by patient will be low. And if you scan patient slowly, so your pitch factor is very low, okay, so the patient dose will be higher. Okay, so we will put another term, is called pitch. So we will calculate CTDI volume. CTDI volume, which is equal to CTDI weighted divided by pitch factor. Okay, this to get the dose per certain slice or certain volume of patients. Okay, okay, it's clear for you. So now, this is an example. For instance, this is higher dose and this is lower dose. Okay, here the pitch factor is low pitch and this is high pitch. High pitch enable you to scan to make the dose less concentrated, okay, less absorbent, so the dose will be lower. But here the table movement is very slow, okay, so the dose will be more concentrated, so will give the patient higher dose. So the term is CTDI volume. You will find this term in your CT machine. Any CT machine contains this term, CTDI volume, which is calculated automatically using this phantom, which is calibrated in the factory. Okay, already all this calibration done before the machine come into your place. Okay, so we calculate the phantom using phantom 16 centimeter and phantom 32 centimeter, one for head and another one for abdomen. We have two phantoms, phantom for 16 centimeter, the dimension, okay, which is for CT brain, okay, for head region, and another one for abdomen region, which dimension is 32 centimeter. Okay, we saw the before the machine coming to us here in our hospital must be calibrated to put or to set all these values. Okay, so when you change kV and milliampere and the rotation time and the pitch factor, you will get CTDI volume because it's calculated before. It's already calculated before the machine coming to your place. Okay, so now when you calculate the dose per one slice, but you calculate the dose per 10 slices, not one slice. So the CTDI volume represents the dose per one slice. But if you want to get number of slices, the dose per number of slices, we have scan lengths. We start before liver and we our end after pubic bone. That's in cases like for instance CT abdomen pelvis. So you have to calculate the scan length. So we have another term which is scan length. When we multiply scan length times CTDI volume, we will calculate dose length product. Now we calculated CTDI volume and dose length product. Dose length product depends on the length of scan. So DLB and CTDI volume, you will find these terms in your machines, in any CT machines. Okay, so what's our target? Our target to calculate the effective dose. How can I get it? How can I calculate it? It's easy. After you finish calculating of DLB or after you collected it from the summary page of any scan, you will calculate the effective dose when you multiply the DLB value times tissue weighting factor or the conversion factor. You remember the factor which is related to the effective dose, tissue weighting factor. Each organ has a specific sensitivity to radiation. So you will find here that region of head has conversion factor, okay, 0.0023, but neck 0.005, chest 0.017, higher sensitivity, so higher tissue weighting factor, abdomen 0.015, pelvis 0.019, and so on. So when you scan patients, you have to know which region you scan. If you scan patient for CT neck, it's easy. When I get from my summary page the DLB, okay, it's easy to go through internet to know the tissue weighting factor for neck region, which will be 0.005. So I'll multiply the tissue weighting factor for neck and DLB, so it's easy to get the effective dose of patient. Okay, it's clear for you? Okay, any question? No questions? Let's move. So now we learn it together how to calculate the effective dose of any patient. But if you have a patient for CT abdomen and pelvis, so we have two regions, not one regions. So we have now two different tissue weighting factors. Two different tissue weighting factors, so we have to get an average value. You have to calculate the average of tissue weighting factors, and the average value will be multiplied by DLB for the whole scan length. Okay, it's easy. If I talk about here, for example, okay, if we scan patients for abdomen and pelvis region, this is our scan length, abdomen, pelvis. Okay, you will get DLB value and CTDI volume. CTDI volume, it will be automatically calculated when you both kV and milliampere, because this value already calculated by calibration or using CT dosimetry phantom in the manufacture factory, okay, before the machine coming to you. So DLB depends on scan length. So if I want to calculate DLB equal to scan length times CTDI volume. Okay, but I want to calculate the effective dose, I'll multiply DLB times tissue weighting factor. Tissue weighting factor, which is related to different organs. Okay, if I scan for abdomen pelvis, so the abdomen here I'll get from my table. Abdomen tissue weighting factor is 0.015. Okay, for abdomen tissue weighting factor 0.015, and for pelvis tissue weighting factor is, okay, what? 0.019. So I'll sum together and divide it by 2 to get the average value. So the average value I'll multiply it by DLB, so I'll get the effective dose. The effective dose will be in millisievert. Millisievert, this is the unit of the effective dose, but the unit of DLB is milligray. Okay, okay, so this is the unit of effective dose. Okay, so now you can calculate easily any effective dose of any patient coming to your scan room. It's clear for you? Okay. What are the factors affecting the radiation dose of patient? We talked before about the kV and milliampere, and as I told you before that we have here different factors affecting the patient dose: kV, milliampere, okay, rotation time, pitch, this is the main factor. kV, as I told you before, when we increase kV, we increase kV, increasing dose of patient. Increasing dose of patients, okay, due to or because of we increase the acceleration of electrons, so causing the higher penetration power or higher probability of interaction between the electrons coming from cathode to interact with anode, producing large number of X-ray. So the spectrum will be different, will be like this. So this is low kV, and when we increase kV, this is 30 kV for instance, this is 50 kV. When we increase, will be larger like this, and so on. So increase number of photons, okay, they have the same start, okay, 100 kVb, kilovolts peak, okay, kilovolts peak, because we have a spectrum of X-rays, a spectrum, the area under curve increasing, so we have wide spectrum, so we have higher number of photons, so the intensity increased by 3 to power 3, okay. So the relation between the kV and intensity and dose is directly relationship. Any minimal change in kV causing higher intensity of radiation, causing higher patient dose. Any minimal change of kV, okay. So this for kV. But what about milliampere? Before moving to milliampere, we have to know that kV increasing here. This is an important point, I want to clarify it before moving to milliampere. So here this is the X-ray spectrum, okay. Here is the energy of X-ray produced, and this is the intensity of X-ray. Intensity means number of photons, but energy means energy, okay, penetration power, okay. So now with different kV, here the kV is, for example, 50 kVp, kilovolts peak. The end value here in this curve, sorry, I'll extend this curve to be clear for you. Okay, so the end value, if we represent the kV energy from 0, 20, 50, and this value is 120 kV, kilo electron volt. Okay, this is the energy of X-ray produced. Okay, this for kVp, 50 kVp. Okay, so the end value here will be at 50 kVp. But if we increase the start here as at 20 kV, here 80, what happened to the intensity? Becomes higher, and the peak here move to the right side. The peak of the curve move to the right side. Okay, I increase the kV to be 100. What happened? Curve becomes higher, the intensity increased, and the kVp. That means that the highest energy of X-ray will be 100 kilo electron volt. When we set the energy or kilovolt of in the scan machines to be 100 or 80, so that means that the highest energy of X-ray will be 80 kV or 100. Okay, if you set your kilovolt, if you set the parameter of kilovolt to be 100. So the highest energy will be of X-ray will be 100. Okay, if we set the kV 80 kV, so that means the highest energy of X-ray will be 80 kV, okay, and so on. Okay, so the patient dose will increase with increasing kV, but for milliampere there is a direct relationship between milliampere and dose. When we increasing milliampere, increasing dose. Milliampere affecting on the intensity of X-ray, affecting on the intensity of X-ray, okay, not affecting on the energy of X-ray. So now this is spectrum, energy, intensity. You will find here, this is the first spectrum for 300 milliampere, but if we used 500 milliampere, what will happen to the curve? Okay, this is a curve for 500. So both curves here have the same n, same kV, because they have the same kV. So the energy is the same, but the intensity is different. Okay, so the patient dose will increase, but not like kV. kV causing a higher dose, higher change in patient dose. Okay. We have another parameters like pitch factor, and rotation time. Rotation time, which is related to the rotation of X-ray tube around the patient. The rotation speed. The rotation speed may be reached to 0.2 seconds per one rotation. The tube take one rotation in 0.2 seconds. It's very fast. Okay, in some machines like that. Okay, so when this rotation time increase, that means the X-ray tube takes long time to scan the patient. That means the patient dose will be higher, because the machine takes long time to scan the patient, so a lot of radiation will be absorbed by patients. Okay, the patient will be exposed to higher amounts of radiation. You take long time to rotate around the patient to scan the patients. Okay, for pitch factor, which is related to the table movement, when the table move very fast, so less time, so less scan time, so less patient dose. So there is inversely proportional, pitch is inversely proportional to the patient dose, 1 by dose. Okay, so when we increase the pitch, that means increasing the table movement. That means dose will be less. The dose will be less. All these parameters you can change it easily in your machines, but you have to make an optimization for this parameter to get the best, to get diagnostic image quality. Because sometimes if we change pitch factor to be higher, certain level will cause problem, or will cause losing data in some image, especially in fine details region. Okay, so pitch factor, if we increase pitch factor greater than 1, it will cause problem in fine details, to get fine details. So you have to make sure that your pitch factor is less than 1, especially if you want to scan fine details region like petrous bone or brain, okay, or wrist joints especially. Okay, but if you want to increase pitch factor greater than 1, you can do it in large organs like CT abdomen pelvis or chest region. Okay, in any large organs you can do this. Here we talked about the effect of parameters with those, but now we will talk effect of parameter image quality as well. You have to put in your mind, I want to get optimum diagnostic image, not only to reduce the patient dose, but I want to get optimum diagnostic image. So you have to put it in your mind, okay? So here you see this machine using low milliampere. So the dose is 2 rad. 2 rad is a unit of dose as well, okay? Sometimes using it. And here using high milliampere, that means higher dose. So what's the difference between these two images? The image in the left side is very noisy because low milliampere, that means low number of photons. Remember the spectrum I drew it before. Low intensity of radiation, low intensity of X-ray, low number of photons. So the image will be noisy, will not good image, okay? Okay? But here, with higher dose, the image is good. So you have to select the proper milliampere for any patient. If we scan big patient or fatty patient, okay, like Elijah as well, okay, so we need to increase milliampere to a certain value. But if we scan patient like me, okay, thin patient, so we have to reduce the milliampere. So that's important to select, especially in child cases. If you want to scan any child, so you have to reduce milliampere to a certain value. You have to revise the protocols and the guidelines of the machine itself, or guidelines of AAPM, American Association of Medical Physics. Okay, you have to find all protocols and you have to review it before scanning any patient. Okay, you have to select milliampere suitable for body size. Here, small body size patient, and here large body size patient. Okay, for small you have to reduce milliampere, for large body size you have to increase milliampere, so you will get the same image quality. Okay. Okay, to understand the meaning of noise. The meaning of noise. Noise means that any image of CT or any image in this world will contain number of pixels. It's composed of number of pixels, squares. These pixels in 2 dimensions is called pixel, but in 3 dimensions is called voxel. Each pixel will collect information, will collect number of photons, number of signals. If we use low milliampere, so that means that number of photons will be less or high. If we use low milliampere, if we reduce the milliampere, so number of photons or number of signals which are detected by pixel will be less or be higher? Will be less. So that means that number of photons per pixel or number of signals per pixel will be less. That means that we have incomplete information. Incomplete information means noise. To clarify it for you here, using 120 kVp, kilovolts peak, and 30 milliampere, but here 15. So this is less, and on the right side you will find we used here lower milliampere than the left side. So the noise here is higher than the left side. The noise here represented by the standard deviation. You remember? We calculate for quality assurance standard deviation, which is representing for noise. Okay. Here increasing milliampere, here using low milliampere, using a higher milliampere, here for resolution curve, and this for dose. When we use low dose, okay, and this using high dose, okay. High dose means a high exposure, okay, but with high exposure you will get more smooth image. So if we increase the milliampere higher to a certain value, like child, if we scan babies or child, If we increase milliampere and kV for higher value, so you will get very smooth image, no resolution. You will lose the resolution. So you have to be careful on selecting the proper milliampere for your case. Okay. Okay. Here we have a method to reduce the milliampere with patient. Automatic exposure control or dose modulation, which vary the patient dose or the milliampere value with the contouring of patient. Sometimes you'll find chest region or shoulder region high density region, so need to increase milliampere. But chest region has lung, so air, so low density material, no need to increase milliampere. But abdomen region, soft tissue region, so need to increase the milliampere little bit. But here in pelvis region, so pelvic bones, so higher density region, so you need to increase milliampere. So if we scan patient with the highest value of milliampere, so we will give the patient highest dose, okay, higher dose. But if we change the milliampere with the patient contour, so you will be successful to reduce the patient dose. That's what's happening in dose modulation techniques. Dose modulation techniques is very important to use it, especially for different body contours, for scanning different body contours. Okay, so here, okay, this is a patient, and we scan. We have two types of dose modulation: longitudinal dose modulation and transversal dose modulation. Here, longitudinal dose modulation, so we change the milliampere according to the body region. Here, shoulder region, so increase higher milliampere, but this abdomen region reduce the milliampere. Okay, so you will maintain the image quality level. You will obtain a constant image quality level. Okay, that throws the body length longitudinal with the patient. But there is another type which is transversal modulation. When the X-ray tube rotate around the patient, during rotation around the patient, you will, for example, here, this is axial cut for chest region. Okay, here, this region will give this region low milliampere, because this region, the X-ray tube here and detector in this region, so the X-ray tube here exposing low density materials, because this region contains lung. But when in another region, okay, the X-ray tube will face here shoulder region, so you have to increase the milliampere. And when the tube rotate to another region here, okay, so you have to increase the milliampere, and so on. So this is transverse. It's called transversal modulation. So you have to change milliampere during rotation of X-ray tube around the patient. Okay. This is the curve representing the change or modulation of the dose with patient. Okay. It's clear for you. It's another example for neck and chest region. You see higher dose, and here reducing the milliampere in neck region because low thickness area, and increasing the dose with this shoulder region. Okay. Okay. I'll stop here and continue tomorrow. We'll continue further discussion about the patient dose and factors affecting the patient dose and the image quality